1. A nurse is caring for a child with an acute asthma exacerbation who is receiving nebulized albuterol. The child becomes increasingly agitated, with a heart rate of 160 bpm. What should the nurse do next? Answer. Continue to monitor closely while notifying the provider about the increased heart rate and restlessness. Rationale. Increased heart rate and restlessness are common side effects of albuterol. However, worsening agitation may indicate hypoxia. Continuous monitoring and notifying the provider ensure early intervention. 2. A nurse enters the room of a patient with status asthmaticus who is receiving continuous nebulizer treatments and notices the patient is suddenly quiet with minimal chest movement. What is the nurse's priority action? Answer. Immediately assess the patient's airway, breathing, and initiate emergency response if needed. Rationale. A sudden decrease in breath sounds may indicate respiratory fatigue or impending respiratory failure, requiring urgent assessment and intervention. 3. A patient with asthma is prescribed fluticasone and albuterol inhalers. The nurse educates the patient about medication use. What instructions should be emphasized? Answer. Use the albuterol inhaler first, wait a few minutes, then use the fluticasone inhaler. Rationale. Albuterol is a bronchodilator that opens airways quickly, allowing better absorption of the corticosteroid fluticasone when taken afterward. 4. A nurse is caring for 4 patients. Which patient should be seen first? A patient with asthma who is wheezing mildly, a COPD patient with oxygen saturation of 92%, a patient with pneumonia and a productive cough, or a post-op patient with pain rated 7 out of 10. Answer. The patient with asthma who is wheezing mildly should be seen first. Rationale. Wheezing may indicate airway narrowing and impending respiratory distress, requiring prompt assessment to prevent deterioration. 5. A nurse is delegating tasks during a code blue involving a patient with severe asthma. Which task is appropriate to delegate to a licensed practical nurse, LPN? Answer. Assist in administering prescribed medications under RN supervision. Rationale. LPNs can assist with medication administration but should not lead or manage critical care decisions, which are the RN's responsibility. 6. A patient newly diagnosed with asthma asks how to avoid exacerbations. Which instruction should the nurse prioritize? Answer. Identify and avoid known environmental triggers such as smoke, pollen, and pet dander. Rationale. Avoiding known triggers is key in preventing asthma attacks and reducing the need for rescue medications. 7. A nurse reviews a peak flow meter reading for an asthmatic patient. The reading is in the red zone. What is the nurse's best response? Answer. Administer a rescue inhaler and notify the healthcare provider immediately. Rationale. A red zone reading indicates severe airway narrowing, requiring immediate use of a bronchodilator and potential escalation of care. 8. A nurse is caring for a child hospitalized with asthma who is ready for discharge. Which teaching point should be prioritized for the family? Answer. Demonstrate proper use of inhalers and spacer devices. Rationale. Ensuring correct inhaler technique is critical for effective medication delivery and long-term asthma control. 9. A nurse is educating a patient with asthma on when to seek emergency care. Which symptoms should the nurse include? Answer. Use of accessory muscles and inability to speak in full sentences. Rationale. These signs indicate severe respiratory distress, and the patient should seek emergency care immediately. 10. A patient with asthma is on high-dose corticosteroids. What is a critical assessment the nurse must perform regularly? Answer. Monitor for signs of infection and elevated blood glucose levels. Rationale. Corticosteroids suppress the immune system and raise blood glucose levels, increasing infection and hyperglycemia risk. 11. A nurse is developing an asthma action plan for a school-age child. What is the most important component to include? Answer. Specific instructions for medication used based on peak flow readings. Rationale. A tailored action plan helps manage asthma proactively and guides decisions during early signs of worsening symptoms. 12. During a home visit, A nurse finds a child with asthma living in a household where family members smoke indoors. What should the nurse do first? Answer: educate the family about the impact of secondhand smoke and recommend smoking outside or quitting. Rationale: secondhand smoke is a major trigger for asthma, and reducing exposure is essential for asthma management. 13. A nurse is caring for a patient experiencing an asthma attack. The provider orders oxygen via nasal cannula at 2 liters per minute, albuterol nebulizer, and 4-methylprednisolone. What should the nurse do first? Answer: administer the albuterol nebulizer treatment. Rationale: albuterol acts quickly to relieve bronchospasm and is the immediate intervention of choice during an asthma attack. 14. A nurse observes a patient using a metered-dose inhaler incorrectly. What is the nurse's best action? Answer: re-educate the patient by demonstrating, and then having them return demonstrate the correct technique. Rationale: proper inhaler use is vital for medication effectiveness. Return demonstration confirms the patient has learned the correct method. 15. A nurse is preparing to administer a corticosteroid inhaler. What nursing intervention should follow administration? Answer: instruct the patient to rinse their mouth thoroughly after use. Rationale: rinsing the mouth prevents oral candidiasis, a common side effect of inhaled corticosteroids. 16. A patient reports frequent nocturnal asthma symptoms. What action should the nurse take? Answer: notify the provider, as this may indicate poor asthma control requiring medication adjustment. Rationale: nighttime symptoms suggest inadequate control and need evaluation and possible medication changes to prevent worsening. 17. A nurse is teaching a patient about using a dry powder inhaler DPI. What should the nurse include in the teaching? Answer: inhale deeply and forcefully to ensure adequate drug delivery. Rationale: DPIs rely on the patient's inspiratory effort, so a strong, deep inhalation is required for proper medication dispersion. 18. A school nurse is managing a student with asthma. The student forgets their rescue inhaler during a field trip and begins to wheeze. What is the nurse's priority action? Answer: activate emergency medical services and follow the student's emergency action plan. Rationale: without a rescue inhaler, the child is at risk for rapid deterioration, and emergency intervention is necessary. 19. A nurse is teaching asthma self-management to a teenager. What strategy will most likely improve adherence? Answer: involve the teen in developing their asthma action plan and setting reminders. Rationale: engaging adolescents in their care improves motivation, accountability, and adherence to treatment regimens. 20. During shift handoff, a nurse learns that a patient with asthma had 2 nebulizer treatments overnight. What assessment should be prioritized at the start of the shift? Answer: assess the patient's respiratory rate, lung sounds, and oxygen saturation. Rationale: frequent nebulizer use indicates instability. Assessing respiratory status ensures timely detection of any ongoing respiratory compromise. 21. A nurse is providing discharge instructions to a parent of a child with newly diagnosed asthma. Which safety measure should be emphasized first? Answer: keep rescue medication readily accessible at all times. Rationale: ensuring quick access to rescue medication can prevent worsening of acute asthma symptoms and reduce emergency visits. 22. A nurse is assessing a patient with asthma who complains of chest tightness and wheezing despite scheduled medication use. What is the nurse's priority action? Answer: evaluate peak expiratory flow rate to assess current lung function. Rationale: peak flow measurement provides objective data to determine the severity of airway obstruction and guide immediate treatment. 23. A nurse notices that a patient with asthma has a barrel-shaped chest and is using pursed lip breathing. What should the nurse consider? Answer: these are signs of chronic air trapping and possible progression to chronic respiratory issues. Rationale: a barrel chest and pursed lip breathing indicate long-standing respiratory effort, often due to poorly controlled asthma or COPD-like changes. 24. A patient is prescribed Monteliacast for asthma control. What teaching point should the nurse include? Answer: take the medication once daily in the evening as prescribed, even when asymptomatic. Rationale: Montelukast is a leukotriene receptor antagonist used for long-term control and should be taken consistently for effectiveness. 25. A patient with a history of asthma tells the nurse they frequently skip maintenance inhalers when feeling well. What is the nurse's best response? Answer: explain that maintenance inhalers help prevent attacks and must be taken regularly. Rationale: maintenance therapy controls inflammation and airway hyperreactivity, reducing the risk of sudden exacerbations. 26. A nurse is assessing a patient after administering ipratropium bromide via nebulizer. Which finding indicates a therapeutic response? Answer: decreased wheezing and improved air entry on auscultation. Rationale: ipratropium is an anticholinergic bronchodilator. Its effectiveness is measured by improved breathing and reduced wheezing. 27. A nurse is reviewing a patient's medication list and notes they are taking a beta blocker. What should the nurse do for a patient with asthma? Answer: notify the provider, as beta blockers may exacerbate bronchospasm in asthma. Rationale: non-selective beta blockers can block beta 2 receptors in the lungs, leading to bronchoconstriction and worsening asthma. 28. A nurse is preparing to administer the first dose of a biologic agent, omalizumab, to a patient with severe allergic asthma. What is the priority nursing consideration? Answer: monitor closely for signs of anaphylaxis during and after administration. Rationale: omalizumab has a risk of anaphylaxis, especially with initial doses, requiring close observation and emergency preparedness. 29. A patient using a corticosteroid inhaler complains of a sore mouth and white patches on the tongue. What should the nurse suspect? Answer: the patient may have developed oral candidiasis due to improper inhaler hygiene. Rationale: inhaled corticosteroids can suppress local immunity, leading to fungal infections if the mouth is not rinsed after use. 30. A nurse is educating an older adult patient with newly diagnosed asthma. Which barrier to effective self-management should the nurse anticipate? Answer: difficulty with inhaler technique due to decreased hand strength or coordination. Rationale: older adults may struggle with proper inhaler use, requiring assessment of ability and possible device modification. 31. A nurse caring for an asthmatic patient receiving magnesium sulfate 4 during a severe exacerbation should monitor for which adverse effect? Answer: hypotension and respiratory depression. Rationale: magnesium sulfate is a smooth muscle relaxant that can cause systemic hypotension and depress respiratory function if not carefully monitored. 32. A patient presents to the ED with asthma symptoms and reports recently stopping their inhaled corticosteroid due to cost. What is the nurse's first action? Answer: notify the provider and explore low-cost alternatives or patient assistance programs. Rationale: medication non-adherence due to financial barriers must be addressed to prevent exacerbations and promote adherence. 33. A nurse is prioritizing care for patients with respiratory conditions. Which patient should the nurse see first? A patient with asthma and silent chest, a COPD patient requesting a breathing treatment, or a pneumonia patient with a temperature of 101 degrees Fahrenheit? Answer: the patient with asthma and silent chest should be seen first. Rationale: a silent chest may indicate complete airway obstruction and impending respiratory failure, requiring immediate attention. 34. A patient with asthma is prescribed a combination inhaler containing a long-acting beta agonist and corticosteroid. What should the nurse include in teaching? Answer: this medication is for long-term control and should not be used during an acute asthma attack. Rationale: combination inhalers with long-acting agents are not suitable for rescue therapy and are used for maintenance only. 35. A nurse is reviewing asthma triggers with a patient. Which lifestyle modification should be emphasized to reduce asthma exacerbations? Answer: avoid using scented candles, air fresheners, and aerosol sprays. Rationale: Strong odors and aerosols are common irritants that can trigger asthma symptoms and should be avoided. 36. A patient with asthma is started on oral prednisone for a severe exacerbation. What teaching should the nurse provide? Answer. Take the medication with food and do not stop abruptly without provider instruction. Rationale. Corticosteroids can irritate the stomach and suppress adrenal function. Tapering is necessary to avoid adrenal crisis. 37. A nurse is preparing a child for spirometry testing. What instruction should the nurse give to ensure accurate results? Answer. Instruct the child to take a deep breath and blow out as hard and fast as possible. Rationale. Spirometry measures forced expiratory volume and requires a maximal effort to obtain valid results. 38. A school nurse is asked to evaluate a student with asthma who is frequently absent. What is the nurse's best action? Answer. Collaborate with parents and the healthcare provider to assess asthma control and barriers to attendance. Rationale. Chronic absenteeism may reflect poor asthma control or environmental factors that need interdisciplinary intervention. 39. A patient reports taking their short-acting beta-agonist inhaler more than 4 times per day. What is the nurse's priority concern? Answer. This indicates poor asthma control and the need to reassess the treatment regimen. Rationale. Frequent rescue inhaler use suggests suboptimal control, requiring provider notification and adjustment of maintenance therapy. 40. A nurse is assigning care for 4 patients. Which task is appropriate to delegate to a UAP caring for a stable asthmatic patient? Answer. Assist the patient with ambulation and repositioning. Rationale. UAPs can safely assist with non-invasive, routine care such as ambulation, while the nurse retains responsibility for assessment and medication administration. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!